Thank you all for coming. I am going to talk to you today about work that I've been involved in Russia since about 2003. It's hard to imagine that pushing a decade of working in Russia. And we've done a lot of things in Russia. What I want to talk about today is really the overarching question. One of the burning questions that we've had is, where is the epidemic going in Russia? What are the transmission dynamics? What is the trajectory? What does the future of the HIV epidemic look like in Russia? And this is a really important question, and I'll show you why. So I'm going to begin with a brief history of the HIV epidemic in Russia, a little bit of the context, and then talk about why we're concerned about the trajectory. So this slide from UNAIDS shows the number of people living with HIV in Russia from 1990 up through 2007. And you can see that during most of the 1990s, there was not significant spread of HIV in Russia, that the epidemic didn't really take hold until about the year 2000. And it's interesting to note that because in the 1990s, most of the rest of the world was, in fact, experiencing a growing HIV epidemic. So Russia is one of these countries, along with several others in Eastern Europe, that we consider to be latecomers to the HIV epidemic. So to provide some context for that, I think it's important to think about the political change that has happened in Russia. Prior to the 1990s, Russia was a communist state, and then in 1991 there was this transition. Really, many of you are probably too young for this, but I remember it. A really remarkable transition from a communist state to a federal republic with many elements of a democratic government. There was free market economy that was trying to be established, and open borders, which when we think about transmission of infectious diseases, open borders is something really important to think about. But because of this rapid political transition, there was a period of economic chaos in the 1990s, or collapse, to be a little more dramatic, with reduced domestic gross product, increased poverty and unemployment, and sort of any time you have open borders and a depressed economy, there's a real opportunity for illegal drug markets to emerge. And so this did happen in Russia, predominantly heroin coming through Afghanistan. So because of these economic changes, there were some social changes that accompanied this as well. Again, with this mobility, people coming in and going, there was also proliferation of drug use, these markets. That was supply, created the demand, if you will. And for a subset of drug users, commercial sex work really became much more prolific. Not to say it didn't exist in the Soviet era, but it became much more common and much more visible as a way of people supporting their drug habits. So this really created an environment in the 1990s, which once the virus entered Russia, real opportunity for spread. It's really kind of like the perfect storm, if you will, for an emerging HIV epidemic. So this really is not unlike what has happened in other parts of the world. You can see this white slide, the white part of the slide on the left shows HIV epidemics among injection drug users from around the world. You can see explosive growth in Edinburgh, Bangkok, Myanmar, cities in China. So where the virus was present, there was opportunities for these rapidly emerging epidemics. And certainly we saw that happen all over the world. I've added to this published graph my own data, or our own data, from Kaliningrad, Togliatti City, and St. Petersburg, 3 Russian cities showing the same thing. Okay, so this again is not unique. We've seen this before, but what's troubling about this is the fact that these epidemics emerged in the 1980s when HIV was new. We didn't know a lot about it. We didn't understand how it was transmitted. We didn't fully understand how it could be prevented. But that changed over the course of these epidemics. And many of these cities, and New York City is a great example, have really experienced reversals in their HIV epidemic among drug users, because we now know about the virus, we know how to prevent it, we know what is effective prevention. So at a time, so it's troubling to me that this is happening at a time when we know how to prevent HIV transmission among drug users. We can talk more about that later. But so this is the current situation. So because of this rapidly growing epidemic, there are now an estimated approximate 1 million people living in Russia who have HIV. You consider the entire Russian population is about 145 million, so less than half of the population of the US. But they have about almost 1 million people living with HIV. So when you look at this map, this color tells you that the HIV prevalence among adults now exceeds 1%. It looks a lot like many countries in sub-Saharan Africa where the epidemic has been spreading for decades. So this is troubling. Now, many of the people counted in this prevalence estimate are in fact injection drug users, but it begs the question, you know, these are considered generalized epidemics. It begs the question of whether or not Russia is headed toward a more generalized epidemic. Currently, the epidemic is concentrated among drug users, but is that shifting? This is what we don't know. There is some evidence that there's increasing spread of HIV to the so-called general population, so not among drug users. National surveillance data showed that in 2001, only 4% of newly registered cases of HIV were due to heterosexual transmission, again, most of it being among drug users. But by 2010, there was this remarkable shift. Now 40% of newly reported HIV cases in Russia are heterosexually acquired. So some evidence of a shift. We were involved in a study with some colleagues in St. Petersburg who did a study looking, they interviewed people who were newly diagnosed with HIV, who were not drug users, so they had acquired it heterosexually, and they asked them about their drug partners, about their sex partners, and were their sex partners also drug users. So in 2005, 50% of people with heterosexually acquired HIV could say, I have a sex partner who's a drug user. This number went down. In 2008, it was only 37%. So this seems to reflect this spread, okay? People who are heterosexually getting HIV are less likely to be directly connected to a drug user. So that's the background, that's the situation, a rapidly growing epidemic that frankly doesn't show a whole lot of signs of slowing, predominantly among drug users, but concern for spread to beyond drug users. So the framework that has guided a lot of our work has been this theory of core groups in infectious disease epidemiology. So this is the framework that we use to study this phenomenon. So core groups can be individuals, core groups are individuals who are at high risk for HIV acquisition and transmission. And there are multiple ways to define core groups. Being a behavioral epidemiologist, I've chosen to think about core groups behaviorally. What are the behaviors that people engage in that put them at risk for acquiring, transmitting HIV? So for example, injection drug users, men who have sex with men, and female sex workers can be considered a core group for HIV transmission because of the behaviors in which they engage. Bridge populations then are non-core individuals, but individuals who have direct contact with the core. So these are people who by definition are not drug users, MSM, or sex workers, but they have contact with the core. So for example, the non-IDU sex partners of drug users. This is a potential bridge population. The female sex partners of MSM is another one, and the male clients of female sex workers. So these are people who we might consider to be bridge population. And then the general population is really everybody else. Non-core individuals who do not have direct contact with the core. Now I want to pause for just a moment because I realize this language can be off-putting to some. We're basically labeling people based on behaviors with regard to their potential for transmitting HIV. And they're narrowly defined. So I realize this can be off-putting. And I don't mean to label anybody, but I do think it's important to talk about these people and to talk about what's going on. We have to call them something. So for example, you know, everybody's part of the general population. When I talk about the general population, I'm talking about non-core individuals who don't have direct contact with the core. That just gets very wordy. So I'll call them general population. Right. Without trying to label anybody, it's just a way of getting the dialogue moving. Here's the same thing in a picture, and you're going to see this picture a few more times during my presentation, so I'll just take a moment to orient you. Again, these are members of the core, behaviorally defined, at high risk for HIV. They could be either IDU, MSM, or sex workers, they mix with themselves, but they also have contact with people outside the core. Some of these folks have contact with some people out here. So core, bridge, and general. Lots of permutations of how people are mixing, but general framework. So as I said, we've been working in Russia since about 2003 on a variety of different studies. So today I'm going to talk about 4, and I'm going to do it quickly, mindful of the time. We have done work with injection drug users and their non-IDU sex partners. We've done work with MSM and their female sex partners. We've done work with female sex workers and their male clients. The most recent body of work I've been involved in that's particularly exciting to me at this moment in time is male sex workers. We don't know who they're having sex with. This is a population about which very little is known, so I put the question marks here. Our work was really designed to figure out, are they a core group and could there possibly be bridging? At this point in time, we didn't know. But so I'm going to go through each of these studies quickly and let you know kind of our key findings. A lot of these studies, a lot more work has been done than what I'm going to present today. Today I really just want to focus on the key findings that we have related to this potential for spread of the HIV epidemic. So I'll do the injection drug users first. So we did a study in St. Petersburg, Russia, affectionately known as SATHCAP, which stands for the Sexual Acquisition and Transmission of HIV. It was a cooperative agreement study. We were one site of several. All of the other sites were in the US. And the overarching goal of this was to do exactly what I said we've been wanting to do, to look at the potential for HIV transmission within the core and beyond the core in these 2 populations that we know are at high risk for HIV, drug users and men who have sex with men. So we did a cross-sectional study between 2005 2008. That was when we collected the data. Our participants included drug users, men who have sex with men, and their sex partners. And we recruited this sample through respondent-driven sampling, which is a form of chain referral. So we identified some drug users who came into the study, and then we gave them coupons to bring in their friends who they knew were drug users, and so on and so on. And for data collection, we did an interview. And we did testing for HIV and other sexually transmitted infections. That's all I'm going to say about the methods. I could say a whole lot more about the methods, but I really want to focus on the results because they're interesting. And I'm happy to take questions about the methods either at the end or at any other time. This is not a methods talk. So here are the results. So we recruited 631 drug users in this study who reported on 709 sex partnerships. So the first thing, so there's a lot of data on the slide, so I'll go through it kind of slowly. The first thing to note, the HIV prevalence among these drug users was 45%, which is really high. And I'll come back and show you how high that is. And 84% of the drug users in our sample reported being sexually active. They're young. The drug users in St. Petersburg tend to be young. They're very sexually active. So then we asked them about their sex partners. 54% of them reported having sex with other drug users. Okay, so this is sexual transmission, but within the core, if you will, if they're having sex with other drug users. But 40% of them reported these types of partnerships. 40% of the drug users said they were having sex with someone who was not a drug user. So this is the potential for bridging we're talking about. And in those relationships, 41% reported having unsafe sex. So high HIV, high levels of sexual activity, and a fair amount of mixing, okay, across these groups, and suboptimal condom use. We were interested in sort of characterizing these relationships, like what are these relationships? So we did that. And we looked at a variety of different factors to see if we could characterize them. And the thing that I found most interesting is that these bridging relationships were most often reported by male IDU. So the common pattern is that the male is the injection drug user, and the sex partner, the non-drug using sex partner, is female. So there are lots of interesting things we could talk about around relation dynamics. But they were more highly educated. which I can't really explain that. These were more likely to be main partnerships, relationships where there was a purported level of commitment. And I suppose the good news is that condom use was reported more frequently in these bridging relationships. So condom use was more likely to be used in these relationships than in these relationships. So that's good for these guys. You know, it's not great for these guys because they should be using condoms too. We were able, in this study, to recruit a small number of these members of the bridge population, okay? So the drug users came in, they did our survey. We said, would you be willing to bring in your sex partners who don't use drugs? Some of them did. We got a total of 53. Not a huge number. Not an easy population to reach. But what we found is 15% of these people were in fact HIV positive. Okay, so these are non-drug users having sex with drug users, and that's their positivity. They also had what, in my opinion, is a fairly high level of sexual risk for HIV and other STIs. So a majority of them reported at least one, what we call high-risk sexual behavior, either having recent new sex partners, reporting unsafe sex, or having multiple partners. So they're having sex with a drug user. Some of them have HIV, and they have a pretty risky sexual profile. So I'm going to summarize the IDU before I move on to the other populations, just so it all sticks. I conclude from these data that the potential for bridging of HIV, that is HIV transmission between drug users and their sex partners, is real and maybe even high. This high prevalence in the core, that 45% prevalence in the core, certainly suggests transmission can happen. The high levels of sexual activity of the drug users, including many of them having non-drug using sex partners, and also the high risk behaviors among these potential bridgers, plus the fact that HIV appears to have seeded in this population. So this is something that concerns me. Okay, I'll come back to the IDU when we tie it all together. So now I want to move into the second population. I'm going to do 4. So these are men who have sex with men. So the study we did of men who have sex with men is the same study that I just presented, the SAFCAP study. So I won't do the methods here. I do just want to show some pictures. This is a picture of St. Petersburg, a historical picture of Nevsky Prospect. So anybody who's been to St. Petersburg has probably been to Nevsky Prospect. It's one of the main roads in a very nice part of town. The hotels where I stay are right along this road. I walk this road all the time, and this is a bridge, okay, that goes over, I believe it's a canal. The Fontanka is a canal, right? Yeah. And marking this bridge are these 4 statues, and these are really beautiful statues. This is what they look like today. They're called the horse tamers, and they're really beautiful. And I think they're an important landmark in St. Petersburg, a well-known landmark in St. Petersburg. So I show these to you today because they also appear on the cover of a brochure that you can get in St. Petersburg today about Gay St. Petersburg. So this is a brochure that I've scanned in, and here's the statue on that bridge I just showed you. This was published in 2007, and it says at the bottom, I don't know if you can read it, this is a queer map of St. Petersburg. And you open up, it's like this, you know, multifold brochure, and you open it up, and it's all about gay life in St. Petersburg. So there's websites to go to, and there are clubs to go to. This one is a club called Bunker, and I'm going to come back and we're going to talk more about Bunker in a minute. I think the point of this is that gay life is very present in St. Petersburg. It is somewhat open. It's not completely open. It's probably more open than other places in Russia, but maybe not as open as other places in the world. But the point is that it exists. It's there. So it's really important that we understand what their risks are for HIV. So this same figure, so we looked at the potential for bridging by men who have sex with men. We recruited 253 men who have sex with men in this study who reported on 564 sex partnerships. And here's what we found. So again, this is very parallel to what I showed you before. 10% of the MSM in this study were in fact HIV infected. But what's interesting is to look at that. Some of the men who have sex with men also reported being injection drug users. So if you separate that out, among the non-injection drug users, the prevalence was 7%. And among the drug users, the prevalence was 45%. So this looks an awful lot like the estimate among the drug users I just presented. So this is an interesting group. But among the non-drug using men who have sex with men, HIV prevalence was about 7%. Very sexually active, 94% of them reported being sexually active. So if you look at who they're having sex with, again, here they are in the core, most of them, 95% of their sex partners were reported to be other men. And only 5% reported having a female sex partner. So again, this is that potential for bridging that we talk about. Transmission within the core is important. But when you think about bridging, only 5% of their sex partners were female. However, about a third of the time in those relationships, they weren't using condoms. So, similar to the IDU, we wanted to try to describe these guys. So how are these guys, different from these guys, those that have the potential for bridging versus those who don't? We looked at a lot of factors to see if we could distinguish these two groups of MSM. The only factor that emerged was drug use. So the men who have sex with men who are also injection drug users are much more likely to be the ones who also have a female sex partner. Okay, big, big difference. We were able to recruit an even smaller number of these people, the women, the bridge women. So these are the women who report having sex with somebody that they know is a male sex worker. We only recruited 18. Again, there weren't many to recruit because not too many of the men said they had female sex partners. But we found 18 of them. 2 of them were also HIV positive. Those same 2 women were also drug users themselves. And of these 18, 12 reported new sex partners and 15 reported multiple partners. So very similar to what I showed for the IDU. These potential bridgers, HIV is present in the population. This population has been seeded, if you will. And they tend to display a fairly high risk profile for HIV and STI acquisition and transmission around things like new partners and multiple partners. So to summarize the MSM, before I go on to the female sex workers, our third population, I think that there is a lower potential for sexual bridging by MSM compared to the IDU. There's a lower HIV prevalence, right, about 7%, and a relatively small number of female sex partners. But I don't want people to think, oh, okay, so this is not a problem. It's still a tremendous problem, maybe not for bridging, but there are other problems we need to be concerned about. First of all, this could be an underestimate. Our colleagues have done some work with men who have sex with men in St. Petersburg and believe that that 5% estimate is too low. It's just, our one study. But other studies show that a higher proportion of men who have sex with men do in fact report having female sex partners, 20%, 30%. So this could be artificially low. Also, this question of transmission within the core, transmission between men who have sex with men is something really important and probably understudied, something we need to think about. And this bridging, the fact that the MSM who also inject have very high prevalence of HIV, and the fact that they're more likely to have sex with women, they may be a small group, but they may be a really vulnerable group, and one that we don't know a whole lot about. So, and could there be bridging between these two core groups, okay? So could the MSM, who are also IDU, be a path of entry of HIV from the IDU community into the MSM community? So some, questions that we don't have the answers to at this point in time. So I want to put this into context because I talk a lot about how big of a problem this is, and I can say these estimates are high, but you may not believe me. So what I want to do is sort of compare our estimates of HIV prevalence and incidence to places around the world. So this is what we found in our study. Again, 45% prevalence of HIV among drug users. Depending on how you do the math, somewhere between 6 to 15% HIV prevalence among these high-risk heterosexuals and 8% among MSM. So this is our work. So comparing our IDU estimate. So these other estimates I put up, this is not a systematic review, it is not a thorough review, it is not a meta-analysis. I simply found some recent published articles with similar populations. So take it for what it's worth. But you can look and see in Scotland, the HIV prevalence among IDU is 2%. Canada, 12%. New York City, 12%. Okay, and these incidence rates in St. Petersburg, we estimate it to be about 14% per year. The incidence in Scotland, less than 1% per year. New York, less than 1% per year. Canada, 3% per year. So really, no matter how you look at it, the HIV epidemic in Russia is, I'm almost at a loss for words. It's extreme and probably unlike any epidemic happening anywhere else in the world. Maybe I'm being overly dramatic. Certainly Ukraine, Estonia, there are other places in Eastern Europe that have seen something similar, but when you think about how big Russia is and that St. Petersburg is a city of 5 million, it's really kind of, it certainly takes my breath away how serious this is. Okay, high-risk heterosexuals in Scotland, about a 1% prevalence. In New York City, about a 9% prevalence. So what we're seeing in St. Petersburg among these so-called high-risk heterosexuals is not unlike what we see in other places. Again, the point being that HIV is present in these populations, and therefore we need to think about how that could change over time. For MSM, you can see prevalence estimates in the UK from 5 to 12%, Australia 8%, Rhode Island 2%, San Francisco 27%, South Africa 26%. So our estimate of 8% is certainly not showing the highest burden of HIV among MSM. In St. Petersburg, there are other places where the burden is greater, but not unlike a lot of other places in the world as well. So just to put this into context, I hope this sort of gives you some sense for why we think these estimates are somewhat problematic. So I want to move on to the third population, female sex workers and their sex partners. I don't know if this image projects very well, but these are, in fact, female sex workers in Russia. This picture was taken by one of our colleagues at our partnering NGO, Stellit, in St. Petersburg. And one of the things that really struck me when I started doing work with female sex workers in Russia. So these are women who, so first I should say female sex work in Russia is quite varied. And the work that I've done has focused on the street-based sex workers. So there's brothel-based, escort-based, hotel-based, but we're talking about the street-based sex workers, so you can see them on the street. And we talk a lot in HIV about studying vulnerable populations and hidden populations. And one of the things that really struck me is that this is not a hidden population. These women are actually quite easy to find and talk to. The locations where they work, these women are standing on a road. It's like a commuter road that goes from the central city to the suburbs. Men know where to find them, and we know where to find them. So vulnerable, yes. Hidden, probably not so much. So the question around bridging, so these women have, we talk a lot about research focused on these women. Again, the bridging question is one about whether or not their male clients could play a role in bridging HIV. In St. Petersburg, most of the street-based sex workers are in fact injection drug users, a vast majority of them, and they have a high HIV prevalence. Last estimated in 2003 was 48%. So given the high prevalence, given their work, could this be a potential path of transmission? So studies have been done all over the globe looking at the role of male clients in HIV transmission. This had never been done anywhere in Russia. So we thought it was important to take a look. So we did a pilot study which included a formative phase to develop a typology. We really wanted to describe this phenomenon of the male clients of the street-based sex workers. And our colleague, Olga Levina, who's here with us today, very elegantly wrote up the findings of that, and it's being published in the Applied Anthropology Journal, Human Organization. I would be delighted to share that with people. So that was one thing, was really to describe this phenomenon, and so we've done that. The other thing was we wanted to know, can we recruit these guys? Like, can we get them to participate in a research study? And if we can, what can we learn from them? The women, the sex workers, if they would bring in their clients. When they did bring in their clients, we asked their clients to bring in their friends who they knew to also purchase sex. We also tried street intercepts, so actually going to where the women are working and getting the clients that way, and clinician referrals from a city STI clinic. We asked the clinician to refer patients who he knew had purchased sex. So we did a structured face-to-face interview with the men who we got in the study, asked a bunch of questions. A lot of this work happened on the van. So this is the outreach van that is run by Stellit, again, which is our partnering NGO in St. Petersburg. So this is the van, this is what it looks like, and it goes out to where the women are working, and the women can come on the van and talk to the doctors. She's a psychiatrist and she's a gynecologist, and they get services. They get condoms, they get referrals for health care, and they get social support, they get a bunch of things. So what we did, and actually this is Natasha, and she actually did most of the interviews for this particular project. So the women would come on the van, they would get their condoms, they'd get their services, whatever needs, questions they had, those were all met, and then they were offered if they wanted to bring their clients in for a research study. And those who agreed, we gave them coupons to give to their clients to come and be in the study. So we recruited 62 clients during a 9-week period. Most of the clients came in because they were referred by the female sex workers or through their peers, and smaller numbers through these other methods. Participation, I thought, was pretty good. Our goal was 60, and so we achieved that goal. We actually got 62. We did use this coupon method of, giving coupons to the women to give to their clients, and then giving coupons to the clients to give to their friends. And it's a little bit difficult to calculate an exact response rate, but I can say that 112 coupons were given, and 60 men came in with their coupons, so over half, so that's pretty good. And I can also say, this isn't quantitative, this is anecdotal, but when I was in St. Petersburg a couple years ago, I had the opportunity to go out on the van, to ride on the van while this work was going on, and I was surprised. We pulled up to a corner where the women are known to work and congregate, and we pulled up and there were a bunch of men there standing with their coupons. And they wanted to come on and do we provided, compensation for this, so I think they were, doing it for that as well. But the men, the one night I was there, and again, it was only one night, but they interviewed several men on the van. They were there, they knew about the study, no shame, nothing embarrassing about it. They wanted to be in the study, and they were interviewed right in front of me. So my impression was that they were willing to participate, some of them. Of course, we don't know about the men who aren't willing to participate, and that's a whole nother story about bias I'm not going to talk about. So here's what they said. So we interviewed these guys, again, the male clients of the female sex workers. They reported having, on average, 5.4 sex partners in the past 12 months, and 3.6 of whom were female sex partners. Interestingly, for bridging, 74% of these guys also reported having non-sex worker sex partners, so like girlfriends, wives, etc. And in these relationships with the non-sex worker sex partners, most of the sex was unprotected, okay, not using condoms. Another way to think about this, we use this model to describe bridging. This was published by people who'd done similar work somewhere in Asia, I forget. And we classified our sample according to the likelihood that they could play a role in bridging of HIV. So men who reported not using condoms all the time with both sex workers and non-sex workers, we consider them active bridgers. Men who reported using condoms all the time with sex workers, but not all the time with their non-sex worker sex partners, those are potential bridgers. And then the guys who said they use condoms all the time with everybody are unlikely bridgers. Okay, so if you look at it that way, over half our sample, 58% of our sample, reported some potential for bridging because they're having sex with both sex workers and non-sex workers, and they're reporting suboptimal condom use. So over half could play a role in bridging. I'm going to skip that. We asked the clients about their behaviors with their non-sex worker sex partners. 40% of the time it involved alcohol. Much less frequently drugs were involved. But about half the time they were not using condoms. So these are the nature of these relationships. So to sum that up, what we think we now might know about female sex workers and their clients, the potential for these clients to play a role in bridging is real. It's present. I mean, over half of these men are classified as active or potential bridgers. Many of them, 3/4 of them, have non-female sex worker sex partners. So that's a path, a potential path of transmission. Suboptimal condom use with both sex worker and non-sex worker partners, and frequent alcohol use. So I actually skipped it, but I will go back. Alcohol use was involved about half the time in their contacts with sex workers. So fair amount of alcohol use, fair amount of mixing, and not a lot of condom use says that transmission certainly is possible in that population. Although, I mean, our study was too small, we didn't test for HIV in the clients. So the last work I want to talk about is the most recent work we've done with male sex workers. So this is sort of the fourth and final population that could play a role in transmission dynamics of HIV in Russia. And this is a picture from a tourist brochure of Catherine's Park. You know, Russia, I don't know who's been, it's really, it's a beautiful city, and this is a beautiful park. Also on Nevsky Prospect, the same street I talked about before. And this is a statue of Catherine the Great, who was one of the great empresses of Russia in the imperial era. She ruled the later half of the 1700s, and I think is widely renowned as one of the greatest rulers. I guess you just don't get the great after your name for no reason, right? So she's Catherine the Great. She was also, so that's all true. She was also well known, or it has been widely reported or believed, that another defining characteristic is that she had a great many number of lovers. So that's going to become relevant. It's interesting when I come back to this in a minute. By the way, great book. Did you finish it? Great book. Just came out last year called Catherine the Great, about 500 pages by Robert Massey, who's written a lot of books about Russia. A fabulous story of, I think it won the Pulitzer Prize, or maybe. Anyway, I'm about halfway done with it, so I'm not an expert on Catherine the Great yet, but it's a good read. Anyway, we'll come back to her. So male sex workers, we started this work knowing very little about male sex workers. There was one study done in 2001 that interviewed 434 MSM from gay clubs in St. Petersburg, and 2/3 of them reported they had ever sold sex for money. More recent work done by our colleagues in St. Petersburg, I don't have those data, but I think show a similar thing. So this said, we know they exist. A recent study from Moscow, just published last year, reported that 18% of the male sex workers in that relatively small sample were in fact HIV positive. So about all we know about male sex workers in St. Petersburg is that they exist and they may be at risk for HIV. And that's it. So we felt it was important to learn a little bit more about them. So we designed a study to look at the feasibility of recruiting them into a research study. We actually wrote a much larger grant to do this, and it didn't get funded because the reviewers said, you have not demonstrated you can access this population. So we said, fine. So we did a pilot study to show we can access this population. We also wanted to gather preliminary data about HIV-related factors, risk factors, things that influence HIV and risk, to inform future larger studies. In particular, we wanted to describe the variety of male sex work. We wanted to know a little bit about their HIV risks and related behaviors. So we designed a qualitative study, which was really appropriate for this. Qualitative research is very useful when you don't know a lot about your topic and you need to learn. It's also very useful for generating hypotheses. It's really more about depth over breadth. So talking to a smaller number of people and learning all you can to hear their experiences in their own words and to try to derive meaning from that. To guide other studies. So we did this qualitative study that included in-depth interviews. We audio recorded and transcribed these interviews, and then we did thematic coding by 3 members of the research team. So myself, Elizabeth King, and Ksenia Ritson sitting in the audience, and this is us. I took this picture yesterday in my office, and we're actually coding, right? And you can see the coffee and the transcripts and how much fun we're having. Like this has been, I don't know, you can talk to Elizabeth and Ksenia about it because I may be like over bubbly, but it's really been fun. Like we've had a good time. And we're just beginning, right? This is, I should say, this is a work in progress. We have a lot more to do. We haven't analyzed all the data, but what we've done so far has been enlightening, and I'm really grateful to the experience and time from my colleagues because I couldn't have done it without them. But all mistakes are my own. So our sample, we talked to 12 male sex workers and 8 other key informants. The male sex workers we recruited by the internet through professional contacts, people who are collaborators in St. Petersburg know to be male sex workers, and by peer referrals. Once we started talking to a guy, we asked if he could bring in other guys. And the median age of these guys was 22, so they're young. The key informants we talked to represented NGOs in St. Petersburg that are well known to provide services for MSM, gay clubs, and 1 researcher. And they were recruited by a variety of methods as well. So what I'm going to do now, again, this is a work in progress, but I want to share with you what some of the emergent themes have been so far and what we've learned. So the first thing we learned from these interviews is that male sex work is fairly widespread among MSM, but it really depends on your definition. So pretty much everybody we talked to said, oh yeah, it's common, I know a bunch of guys. You know, nobody said it wasn't common or widespread. But it really depends on your definition around what is exchange. So there can be exchange of money, but there can be less formal exchanges. So things like clothes or meals in restaurants and that kind of thing. So these are just some quotes that are illustrative of this. One guy said, yes, it is common. Another guy said, this practice happens a great deal in different situations, in different ways. And a third respondent, when asked about the material exchange, is it necessarily for money or could it be something else? Trips to restaurants or buying clothes, he said, oh, this is far more common. So it really gives you a sense that it happens a lot, but that there's a lot of variability. It's not always this clear exchange of money for sex. One of the things we really wanted to do was to describe the variety of male sex work in St. Petersburg. And this turned out to be very complicated. These men, you know, they can be described on a variety of dimensions. So we selected, for simplicity, for a first pass as a way to begin the process, we selected location of recruitment of client as one way to classify. Again, like I said before, when I talk about core bridge in general, it's not that these are mutually exclusive or not fluid, it's just that this is a useful way to start talking about it. So we selected one dimension and found one way to describe the male sex workers is by where they recruit clients. So I'm going to go through each of these. And again, because this is qualitative research, there will be no p-values, there will be no confidence intervals, just illustrative quotes to support the themes that we feel have emerged from the data. So coming back to Catherine's Garden, I showed that to you before. Here's another picture of Catherine's Garden in the wintertime that I took when I was there a few years ago. Catherine's Garden emerged as one of the places where male sex work happens. Several people talked about Catherine's Park as a location. One of the guys talked about, yeah, in the summertime I sit on the benches, and in the wintertime I walk around the park. In the wintertime it's very cold, so you don't want to sit. But so people talk about sitting on these benches as a way of soliciting clients. The men who work in Catherine's Garden tend to be young, sometimes younger than 16, and economically very vulnerable. This is a place that this location is well known to both locals and tourists. Foreigners who come know about the park and what's available there. The interesting thing is that we don't really know anymore what the volume of male sex work in this location is. Several people talked about it being used less frequently, in part because of the emergence of the internet. You don't have to go stand here if you have a computer to solicit clients. Also homophobia, so it could be risky to be standing out here and to be identified as a male sex worker. Law enforcement, the police are often present in these places. So for a variety of reasons, the volume of sex work happening in these locations may be declining. So here are some quotes. "There is such a place, Catkin Garden, but who is there now? Those who have no access to the internet, and this, the lowest layers." Another, "It's cheap boys who work for a piece of bread." The other location that emerged was the Moscow railway station. Somebody said, you know, boys are constantly approached. I think they have not yet attained the age of 16 and offer some fun in the toilet. But over time, this community has been eliminated. So historically, it's happened there. The degree to which it's happening there now, we just don't know. So the internet. One thing, probably the single clearest emergent theme, is that the internet has greatly facilitated the occurrence of male sex work in Russia, and it can occur in a variety of ways. So this picture, I show this to be illustrative of the fact that you can go to these well-known websites. This was gay.ru, and literally, I think it was like 3 clicks. My Russian colleagues, I won't say who, helped me with this because I can't read the Russian, but literally 3 clicks and here you are. And this is Maxim. I blacked out the eyes. He didn't black them out. Maybe he doesn't mind, but I minded, so I blacked him out. And I also blacked out his phone number. And his slogan is "Maximum Sex with Maxim." And he goes on to describe himself, his age, his height, his weight, some other dimensions. And then he goes on and describes 8,000 rubles for active sex, 6,000 rubles for passive sex. So he's putting his price. He'll come to your apartment. You can go to his apartment. He's up for anything except dirty sex. I'm not sure what dirty is for him, but he's up for anything but dirty sex. And his phone number. And it was like the easiest thing in the world to find this guy. So just as a way of illustrating how this can happen on the internet quite easily. But it does happen in a variety of ways. So there are some websites that are more dating websites, but there are ways on these dating websites of indicating that you're also interested in commercial relationships. So for example, a couple quotes. "The internet, definitely. The wall on BBS website. Dating sites. Sometimes you admire someone's appearance. You write him a compliment and he replies, 'I am 5,000 rubles for 2 hours.' On the Mamba website, a profile highlighted in pink means he is offering sex for money, and those who surf the internet pay attention to it." "Yes, via the internet. The idea came into my head. I placed the ad. The man replied. Nowadays, progress using the internet is not difficult. And what do you use to find clients? Boards, usually, dating sites." So tremendous amount of, I would say, volume of sex work happening via the internet. There are also clubs and saunas in St. Petersburg where sex can be exchanged transactionally. Most of the respondents we talked to could very readily name for you the 3 or 4 gay clubs in St. Petersburg. These clubs are well known. Everybody could name them. But the thing to note about these clubs is that they don't exist for transactional sex. These are clubs. They're entertainment clubs. People go for bands. People go to socialize. People go to meet romantic partners. People may even go for anonymous sex, but that's not necessarily transactional sex. So they really exist not for transactional sex, but several men reported transactional sex does occur in these settings. So this is Bunker, the club that was advertised on the brochure I showed you before. This is the entrance, and these are pictures on their website. Like this is how they're advertising. Like I just went to the Bunker website, and these were there. We didn't take the pictures. Actually, I think my colleagues were not allowed into Bunker because they're female. You have to be male. So we can't get in, but they put their pictures on the website. And these are what they refer to as cabins, or places where sex can occur. So, couple of quotes. Blue Oyster, Central Station, the club. You know, they're like naming these clubs. And the interviewer said, there may be commercial sex and dating? Yes, of course. Central Station is more for commercial purposes. There is a dark room, but the money is still more through the internet, where it can all be negotiated when there is correspondence. So again, coming back to the ease of using the internet. And then describing Bunker, there are several toilet stalls with a hole in the wall below the belt. There are several mazes where all this can happen. And then he goes on to say, there is not even music, only pornography on the screen. So there's a real range of these types of clubs. Sorry, I'm looking at the time. I'll hurry up, but I'm almost done. So what I've described up till now are the guys who work alone, individually. We did also uncover sex work that occurs in a more organized fashion through the use of agencies or pimps, whatever you want to call it. So like, for example, one guy said, I've never seen him, but he calls me and says, you have to drive to the hotel. His agency is in Moscow. He added me on the internet. I transfer the money through the terminal using a bank card. He takes 30 to 40%. Yes, he has his own website. So again, the internet even being used for agency-based sex work. The advantages and disadvantages were well described. I think that first quote is sufficient. The big disadvantage to working with an agency is that you have to give them part of your earnings, but the benefit is that someone else does the work for you around identifying clients. So I've described the main types, but I think it's important to note that these descriptions may not be representative, mutually exclusive, or complete. Those types were widely described by most of the people we talked to, but we did uncover a couple of other types of male sex work. So this first quote, you know, they're pretty nice guys who know their own worth. If they make suggestions, they say, I'm 300,000 rubles per month if you want to be with me. It's like $1,000, I think. Yeah. Turns out to be something like a marriage of convenience. And then the final group that we really did not uncover in our work, but I continue to think about, are the male sex workers who are involved in drug use. So this was a quote actually from one of the outreach workers saying, our jails, our prison camps, they are predisposed to this, men having sex with men, and many receive their first experience there. That is, they are drug addicts, and in their addiction, their usage, they will search for any way to get these drugs. And then they go on and say some people steal. Those who can't steal, these people are inclined to get money through sex. So we did not talk, we talked to a guy who fit this profile. So I'm pretty sure they exist. We didn't actually talk to any male sex workers who reported drug addiction. So it's kind of an open question. A couple more topics very quickly around HIV risk. Perceived risk for HIV was almost universally reported, but in a really abstract way. So the guys were all like, yeah, I mean, everybody's at risk. Sure, I'm at risk. But it wasn't a very salient thing. There wasn't a lot of personal experience. People were not saying, yes, I'm at risk because of my behaviors, or yes, I'm at risk. I have friends who I know are HIV infected. It was things like, of course there is risk for HIV. Even condom manufacturers do not provide 100% guarantee that during sex, condom will not burst, slip, or break. Another respondent, when asked, do you think you are at risk for HIV? He said, well, certainly, but, and then he did the Russian equivalent of knocking on wood. He actually spit over his left shoulder, I'm told is the, you know, Russian equivalent. You know, it's like, so it's not this like, these are my behaviors, this is how the virus is transmitted. It's more like, yeah, sure, but, you know, which is a scary thing. So the risks seem to be abstract, not salient. Condom use. So people always say, oh yeah, I use condoms. But then when you probe, you find out that they don't use condoms all the time. They don't use condoms if they're offered more money. They don't use condoms if it's oral sex. They don't use condoms. Sometimes they're just caught up in the moment, right? Like this guy, caught up in the moment. They don't use condoms if they're with known clients. Like, oh, I knew the guy, it wasn't my first time. You know, and a couple of the guys reported not using condoms with women. So it's like, yeah, condoms, we use them, and then you find out that often they don't. And this is actually very similar to what we've learned from female sex workers. My final topic is about alcohol use. This was commonly reported, but mostly moderate and primarily to relax. So the guys would say, in the club, you take yourself a shot of vodka for ease of gait, well, plus for courage. You can drink if you like. Sometimes they offer a drink, a glass of wine, whiskey, and Coke, but we're not drunk. Drink a glass and relax. Like a couple of the guys noted, it's not good to get drunk, right? Because they have a job to perform, and it could be difficult to do that if they're too drunk. So they drink a little bit to relax. So this is really a work in progress. I believe this is a diverse group that requires multiple strategies for research recruitment, and I'm concerned enough about their risk for HIV based on their limited risk perception, their alcohol use, and not always using condoms to think that more research with these guys is going to be important. I will make this my final slide. I think that the force of HIV infection in St. Petersburg remains among injection drug users. Transmission to their partners is likely. The degree to which it's going to go beyond their partners into the so-called general population, we're a little less certain, but clearly the drug users and their partners are at risk. Male sex, MSM and male sex workers may be playing a smaller role in bridging, but HIV is present in these populations in non-trivial amounts. So spread is possible. There might be certain subgroups at risk, the MSM who are also drug users, or the male sex workers who are also drug users. That's a really important thought, and that these groups may be understudied. So I think we really need to do a lot of continued monitoring in Russia around this. Really, where are we and where are we going? And a lot more work needs to be done to understand much better what the risks are here.